Dr. Charlie Grove. So, of course, there's been a huge increase in conversation in our culture around psychedelics in recent years. So much talk about research and findings and experimentation, and patients are trying, and people are trying all different things. The regulations are changing, the legislation is changing. And so, of course, I can't cover, we can't begin to cover the breadth of the subject. But I do want to cover today some of the sort of high-level features of psychedelic psychotherapy, and also to lay out with you some of the ways to think about risks and benefits, so that you can talk with patients, with people around you in an informed and harm reduction way. Just for frame of reference, this is a field I've been interested in pretty much across my life, and in a more formal study kind of way for the past decade or so. I've done a whole bunch of very extensive training, have done a whole bunch of my own therapy using ketamine, and have sat with some hundreds of sessions with patients doing that work. So I'm not going to go deep into the research. You likely have heard some of the high-level findings already, like ketamine can erase suicidality in 60% of people showing up to emergency departments, or that in meta-analyses, ketamine is shown to be highly efficacious for treatment-resistant depression, bipolar, chronic pain, substance use disorders. Dr. Altobelli mentioned the pretty extraordinary 60% number from the MDMA studies in which folks no longer met the criteria for PTSD. Very interestingly, that number of 67%, that was a year after the end of the study. As the study ended, the recovery rate was 56%. So 1 year after the treatment ended, people continued to get better, and that is unlike anything else that happens in pharmacology. Similarly, psilocybin, smaller studies because this is still emerging, but taking cigarette smokers, and 6 months later, 80% abstinence rate, more than double what typically happens with smoking cessation. And very famously, end-of-life cancer anxiety. Dr. Grove will be here, so I'm certainly not going to speak to that very much. But again, 6 months after treatment, 60% of folks, their symptoms are back in the normal range. So it's clear that big things can happen with these substances. Now, what are they? The word psychedelic was coined by Humphrey Osmond. You saw his photo earlier. And the etymology, the way he put it together, is psyche and delic, intended to mean mind manifesting. This was in a personal letter he was writing to Aldous Huxley. And the idea was he chose this language to say that it brings forward the contents of the mind, the breadth of what's inside. And that's not just a simple idea. A year later, in a more formal publication, Osmond said, listen, these substances have huge philosophical and social and religious ramifications that are going to have to be addressed and thought out. And that's really what I think of, hopefully, what I'm able to participate in today with you. Because from the beginning, psychedelics have been recognized not just as a new tool, drug-wise, but they're different in that they catalyze shifts in thinking, in cognition. And an interesting example of sort of the complexity of it is even playing with the etymology of psychedelic. Psyche, we often describe it as mind, but it can just as readily be understood to mean soul. And psychology, what are we doing in psychology? Are we studying the soul? Are we studying the mind? I could talk about that all day with you. So psychedelics, though, have a very, very extensive history with human use. And so I'm going to quote from a colleague, not a colleague, really a teacher of mine, Belinda Ariacho, who's a Dene cultural background, or Navajo. And she wrote that since the beginning of time, plants have been used by indigenous people around the globe for medicinal, utilitarian, and subsistence purposes. It's documented that there are 70,000 plant species for medicinal use. A portion of those plants have been and continue to be used in ceremonial practice to reach non-ordinary states of consciousness. From an indigenous perspective, these entheogens, or sacred medicines, are part of the cosmology of their culture and have been for millennia. This cosmology includes an interrelationship between humans and the plant kingdom. Each plant holds a wealth of wisdom and potential for healing humanity. Now, what you're hearing in that language is the animistic worldview that is very widespread among traditional cultures. And animism, the idea that objects, places, creatures possess a spiritual presence, that everything is alive. And this is not the worldview of the West. I'll be touching on that shortly. But I really just want to position, like, what is the ground that we're walking into as contemporary psychedelic therapists? And the point is, this isn't just a thing that happens in other cultures. When Westerners do these substances, 10% of LSD users report having had an experience of turning into an animal. 25% of ayahuasca users report having turned into an animal. People that use DMT, a very potent psychedelic, very commonly describe feeling the sentience of non-living things or encountering spirits and entities. So something happens. I'm not going to tell you what that is, but things happen. Now, what is it, Rick? What is it? I heard an idea today, and it's that hopefully we're all packing our bags for a trip, but we don't know what the destination is. And that's, I think, what we're up to. So, in terms of how to think how these things work, Eva touched a bit on the biological and the neuronal. I'm going to lay that out in a somewhat more sort of conceptual way, but I'm also going to touch on the kind of conventional, mystical, or spiritual way to think about it, as well as some of the other ways that contemporary research is looking at psychedelics. So this is 2012. This was one of the first studies putting people into a brain scanner on mushrooms, and what was expected at the time was that scientists thought that they were going to see the active, interconnected parts of the mind come alive. And in fact, they got quiet. This was the opposite finding of what was expected. There was decreased activity. What we understand this to be now is the default mode network getting quiet. So there's a reduction in that default mode network. And so in that way, the mind on psilocybin becomes more disconnected or more fragmented. And what happens with that is that disconnection or that fragmentation is a fragmentation of the conventional framing and rigidity. What ends up happening instead is a host of weak correlations. All kinds of little possibilities emerge in the inner connections of the mind. And that is referred to in much of the research as noting the entropy that happens in the brain. The entropic brain is sort of the predominant hypothesis of the leading psychedelic researcher, Robin Carhart Harris. So entropy is often understood, it's sort of misunderstood as chaos, but technically entropy refers to variety and possibility, the degree of randomness and richness of possibility. And so in normal waking consciousness, there's not much entropy. Our brain is positioned in something closer to extreme order or rigidity. Psychedelics break down that rigidity, that order. So you can see on the left-hand side, the entropy increases. And as entropy increases, order starts to break down, and in that, in between, it's called criticality or supercriticality, as the mind moves into this more disordered, rich, interconnected state, there's a chance to establish things that are new. And so the brain becomes more sensitive to context. That means both the bottom-up flow of information, of feeling, of the limbic system, of somatic experience, and so too is the system more amenable to changes in context, like relationship. And many of you probably know the work of Dan Siegel, the great psychologist here in town. He describes mental health as being in between too much chaos and too much rigidity. And so you can sort of hear that model in this entropic brain, that we're trying to work on the right zone of not too much rigid and just too much potential. Traditionally, psychedelics are thought to be useful via the way in which they can facilitate or occasion a mystical experience. Now, the notion of the mystical experience is often dated back to, at least in Western scientific writing, to William James, and in his great collection of lectures, The Varieties of Religious Experience. And he had 4 criteria of mystical experience. There are a variety of typologies, 4, 6, 7. This is sort of a conventional collection of the kinds of qualities of a mystical experience. And in 2006, the Johns Hopkins research done by Roland Griffiths, which was sort of the modern reemergence of psychedelic research at Johns Hopkins, and it found that psilocybin will reliably provide mystical experiences that people describe as highly personally meaningful, like top 5 most meaningful experiences in their life. And a meta-analysis done in recent years, they show time and time again that whether or not people have a mystical experience, have an experience of these features, is very predictive of a good outcome from the study, of the mental health benefits are highly correlated with mystical experience. So this is why it's thought to matter. A lot of people think this is the thing. It's measured by the mystical experience questionnaire. You can see some examples here, things like how much you feel in unity with ultimate reality, how much do you have an insight that all is one. And again, if you've really thought about or encountered or can imagine your way into a complete mystical experience of all oneness and the dissolving of subject and object, to then pivot and say, okay, so from 1 to 7, how would you assign that? It's just a little incongruous, but it's what we do. I will add that in terms of mystical experience, there are important critiques about it, that it is very much a Christian, highly informed by kind of Christian notions. It's also a perennial idea. If you're familiar with perennialism from Aldous Huxley, the idea that all the world's religions sort of emerge from core central truths, which in a kind of multicultural, diverse, modern worldview, there's a lot of critiques around that. It's also been called too heteronormative. So some argue that it needs to be updated with more kind of culturally sensitive ways of thinking. But there are other ways too. So Rosalind Watts put together a connectedness scale, how much someone feels connected to themselves, to others, to the world. Roseman has an emotional breakthrough and catharsis scale. And so too is there a scale that looks at psychological insight, or like the sense of taking away something, of learning from the psychedelic experience. And all of these different instruments have been found to predict outcome, and in some studies have been found to predict outcome even better than the mystical experience. So this is evolving, and there is overlap, there may be distinct features. This is where some of the research is going. I will add also that for some of the research on mysticism, it seems like positive changes are more likely for those who come in with a bit of well-being and satisfaction. For people to come in with like real mental health issues, it may or may not be that they need to go straight to mystical. They might need something more like emotional or catharsis or something relational. So, this is super important. I really want to emphasize that psychedelic-assisted psychotherapy is psychotherapy. And we've been doing psychotherapy for well over a century. And in that time, the history of psychotherapy has learned a lot of key features, like there are experiences of transference and attachment matters, the question around rapport and identity and power dynamics. This is all psychotherapy 101. And none of this is left behind. when you do psychedelic therapy. It's not like you just give them the drug and magical things happen. In fact, psychedelics make all of this stuff more exquisite, more immediate, more potent, whether you know it's happening or not. These kind of transferential, relational, attachment themes are up and running in extraordinarily potent ways when you do this work. One of the most important researchers of psychedelics is Stanislav Grof, and he describes psychedelics as non-specific amplifiers. They just amplify, they bring forth in an agnostic way. And so what that means in psychotherapy language is they could amplify alliance and trust and empathy and all these wonderful, like, juicy things. But that non-specific amplifier could also, by the same token, completely amplify ruptures, or the patient feeling misunderstood, or like, oh my God, I'm being dropped and hurt again. And then that matters even more in the moment. But then, by the same token, the non-specific amplifier could then help you do really great repair about the rupture that just happened. Everything is heightened. And so that's going to mean great possibility and expectation. It could also mean great increase in disappointment. So psychedelics are going to amplify both our skills as provider, but also our mistakes. They're agnostic in that way. And so for this reason, I argue you need to be a decent psychotherapist to be a decent psychedelic psychotherapist. You can't just learn psychedelics and think you know what to do. And that's one of the things that makes me queasy about people who are like hopping into facilitating this work, often in the underground. And maybe they've had wonderful spiritual experiences, I won't doubt that. But do you know what it's like to be caught in a really intense enactment or working around sexual transference? It's a thing. And so there starts to be a lot of concerns around ethics and training when you get further into this work. Now, a couple other things I want to emphasize about the nature of this work. The first is process. I never know what's going to happen in a session. And people will often ask me, what can I expect? And I'll give them a menu of like a dozen things and say, maybe none of those, and maybe something else. And I find that wildly exciting and always interesting. But of course, that's also really unnerving. And what I've increasingly come to do, and what I try to convey with patients, is a sense of trusting the process. And in that way, Dr. Altabelli described how providers are less of experts in psychedelic therapy. And there's a lot of discussion instead that we function more as midwives. There's a great big process happening, and we're there to hang in with you through the process. Another quality is presence. And when you're working with someone who's porous, who's open, who's delicate, tender and suggestible, we have to be able to handle their unease, have to be able to show up and be present with them. Patients are often wondering, can you handle what's in me? Like if I bring forth this anger, or if I really acknowledge that fear, can you hang in with me? And it's important that your presence convey a willingness to go there. And the truth is, if you're faking it, they'll know, because people on these substances have increased sensitivity and empathy. And they'll see through you if you're like, oh no, everything's fine. Like it's obvious. And finally, in terms of play, there's a looseness and a playfulness often to this work. If I'm doing a 3-hour session with a patient, half of that I'm sitting on the floor next to them, my kind of conventional demeanor and professional role, it just can't be there. If you're doing a 6-hour MDMA session with a patient, you're going to be eating chips and in your socks. Like it's not the same structure, just unavoidably. It's a whole different set of way of being. And given these great powers, I would argue that what's really important is not to like lean into the kind of heroic role, although that is the great seduction in this work. but rather I think it's a call for caution and humility, and being very mindful of the wild potential and unpredictability of the work. Two other key things in this work. Talking about religion and spirituality. It's well known, this is why the American Psychologist had this article on competencies by Wheaton and Lukoff. Many patients say they'd like to have religion and spirituality come up in therapy, but it's usually not discussed, it's even frowned upon. And similarly, it might be the case that clinicians doing this work might need to be ready to talk about metaphysics. And this is a newer topic. This is a very important paper that advances that idea. And people need to be ready to talk about things that break our normal frame of reality. I'm going to be touching on that in a little bit. But the attitude that I'm into, and this language comes from Jeffrey Kripal, one of the great religious scholars, and he says, believe the experience, but don't believe the beliefs. And that's, I think, really part of the idea here, is I don't need to know what's happening, but I need to join with the patient in their experience, as idiosyncratic or odd as it might be, and be willing to entertain and open to it, not draw my conclusions, but help them find workable, advantageous conclusions of their own. In terms of set and setting, Dr. Altobelli spoke to that a little bit. Typically that's discussed as the physical setup of the room, social setting, like does the patient feel safe with me? Where are they coming in with their expectations? But I really want to emphasize that it's much, much bigger than that. Set and setting is going to be kind of the hottest topic as this work moves forward. I understand Carter Harris is working on really provocative new research about set and setting. It's enormously important, and it's bigger than just the room. And this is an example of that. So the psychedelic revival of recent years has started to create a cultural feedback loop. And so that cultural feedback loop, which is Netflix shows and Time magazine covers, creating all this enthusiasm and excitement about the drug, and then that in turn is affecting people's mindset, what they expect. And we know that mindset affects the outcome, what's going to happen in the experience, and then what happens then feeds back into the cultural discussion. And so what's happening is this feedback loop is starting to shape the actual experiences that people have. And so talking about risks or benefits are both going to affect the outcomes. If you hear, oh yeah, that substance is for crazy people or makes you weird, that's going to have an effect on the outcome. If I tell you, this is the silver bullet and it's totally going to cure you, that's also going to create a feedback and will shape the constrained outcome. So things get really messy in this way. And that's true especially with psychedelics. But the truth is, it's probably true more broadly in healthcare, whether people want to acknowledge that or not. I'm really interested in the work of Ellen Langer at Harvard. She's sometimes called the godmother of mind-body medicine. And you can find her writing on how set and setting probably affects the efficacy of antibiotics, or the progression of a cold virus, or someone's response to their cancer treatment. And so this is a way in which, for me, psychedelics start to usher in questions that are much bigger than just psychedelics. They start to poke at how we think of the world and how our healthcare system is set up and how our systems of governance are set up. There's a lot here. Oh, that again, yeah. Okay, let's see. Let's just see. So that feedback loop that I'm describing has really major implications for how we do research. Because people are coming in with so much expectation, and there's a problem of blinding in that people on these substances know they're on something, and so do the providers can tell that someone's on something.
Can someone come and look?
So that is really challenging how we approach research, and this came up with the.
Thank you so much.
This came up with the FDA reviewing the MDMA research, that it gets very difficult to conduct research as we have conventionally done so. Now there are really interesting new research protocols that are unfolding now. People are rethinking how to do blinding, multiple kinds of doses, crossovers, all these different kinds of study designs to try to boil things down. But it's inevitably slippery and difficult to do. And one of the ways to think about that is this lovely idea of psychedelics as active super placebos. That is, substances that enhance ritual and symbolic and interpersonal therapeutic process by increasing suggestibility and the influence of extrapharmacologic, non-specific factors. So, what this starts to suggest is that this weird placebo expectation thing is not necessarily something we need to control for. That might be part of the mechanism. We might want to lean into the suggestibility. There might be ways to thoughtfully and artfully lean into things like ritual and symbol and interpersonal process to get the most out of the medication. So, by the same token, that great suggestibility also means potential for great harm. So again, I'm always going to come back to this idea, and we have to be thoughtful, and we have to be careful. Because when people are easily suggestible, it's easy to lead them into a bad place intentionally or just through my own unconscious shadow type stuff. And this is part of why I started off with that slide of around an animistic worldview and the traditional relationship of indigenous cultures and these substances, is because over thousands of years of use, cultures figured out systems and routines and rituals to use these and hold these substances in safe and effective ways. Western science has been playing around for a few decades with these things, and we don't really have the norms, and we don't have the systems in place to hold ritual and meaning-making, expectations, social influence, and to fold them into healthcare. Speaking of folding into healthcare, what kind of therapy are you supposed to do with psychedelics? Good question. This to be determined. Right now, there's a lot of different therapies that are often used with psychedelics. Most commonly, you'll hear people describe somatic, EMDR, bodily-based therapies. Internal family systems is very popular. ACT, the depth and kind of depth psychotherapies, Jungian, psychodynamic, relational. But you can also find like CBT and VR, or more sort of spiritually focused psychotherapies. And if you take seriously this idea of the non-specific amplifier, it would suggest that they could speak to a lot of different therapeutic approaches. So theoretically that makes sense. But the truth is, in 5 or 10 years, I suspect it'll be a really different landscape. And that new research and comparative psychotherapy research will happen, and we'll know a lot more. We're really just getting started on this. So in terms of psychedelics and how they make changes happen, I want to come back to this idea of metaphysics or ontology. What is reality? What's going on here? And psychedelics, they seem to affect this. And there's a really interesting question of, is that the mechanism of action by shifting worldview? Is that an unfortunate side effect? What are the problems in that? I'm going to talk about ontologic shock. This isn't always good when your worldview gets exploded. In fact, very often it's not. So to explore some of this area, I first want to name the obvious. which is the worldview that most all of us grew up in and which predominates in the United States and in the West. The modern scientific worldview that is materialism, that the kind of the foundation of reality is matter. Everything is reducible to matter. Only the physical is real. Consciousness and all these other things are then understood as epiphenomenon, or they're emergent, or some kind of like illusion, the illusion of free will, these kinds of ideas. And this worldview, to lean on the great acronym, it is a weird one. And you may know this acronym WEIRD, as in Western, educated, industrialized, rich, and democratic. And so the weird worldview that is taken to be the standard one by the West is actually a small slice of the worldviews that are found on this planet, and in fact is a minority. So what is taken to be standard for most of the world, it is not the standard. There's other possibilities out there. The Western is numerically a minority one. So psychedelics, though, do tend to affect people's set of beliefs about reality. So in this study, there was about 900 folks, and they were studied before and after a psychedelic ceremony. There was significant movement from these folks away from materialism and towards animism, which is also known as panpsychism. And there was also a significant correlation in the study with the more times that people had used, or the length of their use of psychedelics, they were more likely to have a non-materialist worldview. Another study looked at 2,000, some 2,300 folks before and after a powerful psychedelic experience, and a single psychedelic experience increased a range of non-physical beliefs. Things like reincarnation, communication with the dead, the existence of consciousness after death, telepathy, consciousness of animals or rocks. And the more mystical the experience, the more likely people were driven towards these non-physical beliefs. And speaking of not like most other drugs, and this research found that belief in higher power went from 29% to 59%. That doesn't happen with other substances if people start getting in touch with higher power. Something is unique here. So, interestingly, that shift in worldview has also been seen to mediate the effect, the good outcome. So, the greater number of mystical experiences seems to correlate with higher mental health outcomes and improvement. And in this study, that improvement in well-being was specifically mediated by the move from materialism into one alternate worldview, which is idealism. Idealism is the idea that consciousness or mind is the foundation of reality, not the material, but that something comes before, that there's a deeper reality of mind or consciousness. This is an idea that in the West is tied to Plato, who talked about the world of form or ideas. The great Jewish philosopher Spinoza advocated this in the 1600s. It also shows up in the world's religions, in the Hindu concept and Vedanta of Brahman. There are versions of this in Sufi mysticism and in mystical Christianity. So this idea that there is some level of reality that precedes the material is not foreign. It's out there. It's just not part of our normal weird view. And so this idea does contradict kind of standard scientific framing of knowledge. And yet it increases people's well-being when they believe it. So these things are interesting in that they seem to contradict the laws of nature as we understand them, but they're psychologically beneficial. And that's a tension that really runs through a lot of this work. And some folks want to resolve that tension. And that's what this study really shows. That there are some who say, like, listen, this mystical talk, this higher power talk is a problem, this isn't science. And I like this quote, you know, we certainly can't have people interpreting science as advocating a role for the supernatural or divine. And that's a very strong view, and one that, like, we can all expect, and I imagine a lot of us hold in this room. Certainly part of me does. And in fact, these folks would say that if you're encouraging a patient to lean into that higher power, that mystical, that non-material belief, you're just encouraging them in their delusions. And maybe it's okay if, like, their delusions help them, but understand that you're totally lying to them and encouraging, you know, something that is delusional. Mind you, if you're really leaning into that view, you're also sort of implying a denigration of the rest of the non-Western world. So these tensions, there's no escaping these tensions. Which is why I like this response to that previous article. No, actually, we have to work with weirdness. And when you're working with people psychotherapeutically, closely, intimately, in doing depth work, I would argue, and this is the case with most of my colleagues, that the weirdness is unavoidable. That psycho-spiritual, psychic, unusual stuff happens, or it just arises. The number of times I've had patients who are, like, pretty conventional and pretty non-religious come out of the ketamine session and say, yeah, so about my past life. I did not see that coming, but this happens, and so I'm ready for it when it arises. Or they talk about this mystical encounter with, you know, experiencing love from God. And again, Jeffrey Preibel style, I take that experience totally seriously, and I believe the experience. Do I know that God actually just came in on a beam of red light and flew into their heart? I'm not assuming that, but I believe their experience to be real and to be important, and I'm not going to try and decide what's true in that moment. I don't think that's my place. So let's see, harm reduction. Dr. Altobelli spoke a little bit about some of the psychological rule-outs. You know, famously, this is schizophrenia, concern with bipolar, people who are really fragile, really flagrant PTSD that's really destabilized. I don't think she mentioned personality disorders. Again, not a rule out, but go slow and be cautious. So too is that the case with PTSD. And also the truth is, in all of the research studies, there's really heavy screening for this stuff. And we'll find out in the years to come, as exclusion criteria get loosened, where are the danger lines. That's really to be found out. But general rules of thumb for safety are, you know, psychosis, you know, fragile states, really acute distress, recent trauma, that kind of thing. Physiologically, there are some classic concerns with psychedelics in terms of cardiovascular symptoms. So psychedelics often have effects, especially the classic psychedelics, mushrooms, LSD. They affect heart rate, body temperature, blood pressure. So like in the MDMA research studies, there were really extensive cardiac screenings that were done for folks. Seizure disorders are also a very common rule out for using psychedelics. On the balance, if I'm speaking very generically, most of the common psychedelics don't have major immediate medical risks, but that's not entirely true because like iboga or ibogaine, ayahuasca, datura, and even ketamine can have serious side effects for some people in some circumstances. So I can't do justice to the rule-outs here, but I want you to know for yourselves, or if you're talking to patients, to make sure you do your homework on the list of rule-outs, because it really does matter. certainly taking into account questions like family history and medications. So it's very well understood that some medications, especially psychiatric meds, don't interact well at all with psychedelics. And I'm not going to run you through a giant list of those, but that's, again, readily available, and you should check it out. There's strange ones, like people on PrEP medication, PrEP for HIV. There are certain formulations of PrEP that make MDMA or ketamine hit 4 times as hard, and then that can make for really problematic situations. So please, be informed. Similarly, in terms of harm reduction, it's widely important to know what you're taking and to know the purity of it. Of course, in the research studies, that's assured. When someone's using recreational compounds from the street, or when you're seeing someone in an underground setting, it's really hard to know historically like what it is. The good news is we now have fentanyl test strips that are readily available, and I really encourage people, if you're using weird powders, go buy the fentanyl test strips. Similarly, there are now test kits available for testing the potency of psychedelics. Is that really MDMA in that baggie? Do those mushrooms actually have psilocybin in them? You can now find these test kits. They are available, and they're a really important tool for safety. Where'd it go? So, in terms of intention, harm reduction is really going to flow through the question of what are you trying to do here? Are you looking to have fun? Are you trying to heal that giant childhood trauma? Or are you trying to connect with higher power? Whatever your intention is going to shape the experience. If you're really looking to heal that childhood trauma, doing it at a concert is very unlikely to be helpful. And if you're looking to connect with God, then you might have a different consideration than sitting in a psychotherapy office, or maybe that is. It's going to depend. So. I also want to emphasize that part of the reason caution matters is because things do go poorly. And one of the most common ways that famously happens is with sexual transgressions. So in one large study of psychedelic users in the community, 8% reported knowing someone who had inappropriate sexual contact from a guide. Half of those were in the underground. But 5% of people reported unwanted sexual contact with their actual therapist. Another study found 13% of people reported psychedelic sexual transgressions. So this is a real concern and something to be mindful of. And if you're working in the underground, if you see someone doing illegal work in the underground, and something goes wrong, there aren't mechanisms for reporting. You can't report them to their board because they're underground. There aren't systems to redress and find recourse. And so that's one of the things that the formal psychedelic psychotherapy is starting to get better at doing. But it's new. This is still really getting standardized. We can talk about the controversies and the debacles that have happened in the last several years. We could talk about it all day. It's real. Also real is that it's not always easy doing psychedelics. This is a great chart that illustrates how psychedelic experiences often include challenging qualities like muscle tension, stomach pain. It usually gets worse before it gets better. There is sort of a hero's journey quality to the psychedelic art. On the balance, though, a large study in JAMA last year that found serious adverse effects are very low, as in 4%, or another study found 0.2%. Post-trip difficulties, though, are possible. Perceptual, hallucinogen perceptual persistent disorder, derealization and dissociation disorder. Again, this stuff is rare, but it can happen, that someone comes out of the experience stuck in fear or anxiety, paranoia, a sense of disconnection from others. The global ayahuasca survey found that 14% of people reported feeling a harmful connection to the spirit world after their experience. And yet, for all these possibilities, most of the time, 50 to 80% of people report that it was still positive, even though it was so hard. And so there's an important distinction to make between like challenging and damaging. However, you can reduce post-trip difficulties by being mindful of things like being unguided, being in a disagreeable environment, taking a really high dose. Those are going to be more predictive of a tougher outcome. Also, ayahuasca, DMT, and LSD tend to predict tougher outcomes than some of the other substances. How do you treat these things? Well, there's a role, certainly for therapy, of course. There's also a role for medication. Kind of historically, people would say, well, don't put them on meds. They need to work through the material. And I'll go there with you all day long. But sometimes folks are in such acute distress that they just need help to get to bed, or they can't stop shaking moving through the day. They might need some medication relief just to stabilize. And it's also important to consider, are they if you want that patient to like work it through, are they in a stable place where they can kind of be melted down for a while, and do they have to show up to work or show up to family? In a traditional context where there's a kind of ritual and a culture around these altered states, it might be understood that someone kind of cracks up for a little while, and that's all right, and they're supported and they come back. That might not be in place for someone in the West. And it's worth noting that this is not just true of psychedelics. Maybe some of you have heard of the Cheetah House, which is a rehab for people who end up kind of sick after meditation retreats. It's known that people on serious intensive meditation retreats can have derealization, dissociation, energetic experiences. You know, it's kind of a problem when you sit down on the couch and you can't feel the difference between you and the couch. It's cool and mystical on one hand, but it's also hard to move through your day when you can't figure out where you end. And that's why there's a rehab for this. And as a society, we're going to have to build out new systems to take in and support people amidst the weird. In general, what helps, though, is non-pathologizing. Things like, yeah, I've seen this before, other people have had this experience, group support, shared experiences, normalizing is really useful. And generally, there's also a lot of benefit from tuning into the body practices. Maybe not like keep meditating, but more like go for a jog or get your hands in the dirt in the garden tends to be really useful. So when people go to use these substances in a ceremonial context, it's often in a whole different world. Like people travel down to South America to use ayahuasca with various cultures in South America. And down there, those are cultures in which spirits are real. And you can interact with other people's energies. Time doesn't exist. And that is the normal worldview. And what can happen when someone from the West goes down to one of these other cultures, they have the kind of possibility of keeping all that stuff at arm's length, or taking it on as their new worldview, or get caught up in between. So a couple examples to finish up here. I have a patient who grew up in a pretty traditional, industrial, wealthy, white New England family, went down to South America to work on his kind of internal criticisms and difficult kind of negative messages in his mind. He goes down to South America and the shamans explain, oh, those negative messages in your mind, those are demons. Your body is full of demons saying negative things to you. And so he went from, oh, those are critical thoughts to, oh my God, my body is full of demons. And then he winds up back in New England alone, not around a bunch of shamans, but in New England, flooded with demons and totally at a loss with what to do with themselves. Really difficult circumstance to be in. On the other hand, I was just in Mexico a couple weeks ago, and some of you may know La Llorona, the Mexican, actually across Latin America, folktale kind of ghost story of this weeping woman. And there was a woman on the trip with me who was Mexican heritage but grew up in a pretty white neighborhood in Texas. And our bus driver was like, oh yeah, I saw La Llorona last week. Because this is his normal worldview. He's like, yeah, I see La Llorona all the time. Check it out, I've got videos. And this woman from Texas, in that moment was like, oh, what? Like, what was fairy tale growing up? And that moment became real, and I watched her like ontology kind of vibrate. She didn't get stuck in between like my one patient who ended up with a lot of difficulty, but it was this wonderful experience of, yeah, here's that line of the weird. How do we resolve this? I don't know. So instead, what I would suggest is that, as with the entropic brain model, things get messy, things get uncertain, but hopefully we can stay open to new things, and hopefully we can stay open to changing our mind and finding new potentials for healing and for improving our culture. Thanks, folks.
Thank you, Dr. Laramie. Some brief housekeeping. We are on lunch break until 12:55. If our student docents could come up here by the door, for those of you that would like a campus tour or to have your box lunch at the Recovery Center, to visit our Recovery Center, our students are happy to meet any needs you may have. Students, there's pizza for you at the Recovery Center. For the rest of us to your left, our box lunches. We made some decisions here. There are mostly vegetarian wraps. There is also some Caesar salad with chicken and smoked turkey sandwiches. So please grab a box lunch, and you can have it here. We go out to one of our beautiful benches. Our students can guide you to other areas of our campus, and we'll see you at 12:55. Thank you.